My name is Amy Castiglia. I'm in my final semester of the St. Joseph's University Adult Gerontological Primary Care Nurse Practitioner Program, and this is my poster presentation for my Capstone project. On the poster you'll see here, I've listed the issue, and that is that physical inactivity is a worldwide public health issue associated with poor outcomes and death. All right, so with physical inactivity, as most of us know, we see increased cardiovascular disease incidence and mortality, increased cancer incidence and mortality, increased type 2 diabetes incidence, and increased all-cause mortality. Conversely, we know that exercise is associated with decreased cardiovascular risk and decreased all-cause mortality. Exercise also is associated with weight loss, decreased anxiety, improved cognition, and just overall improved quality of life. So with that said, we know that exercise is a primary prevention measure and is often the first line treatment for most of the diseases that we treat in primary care, as it is a lifestyle modification along with diet and other things. So we talk about it a lot in primary care, and I knew that walking was a simple, safe, and accessible form of exercise generally accessible to most people, and that step count could seem like a very simple metric by which to track progress and how much activity a person was getting. So I was wondering if there was evidence to support us using this or recommending walking in primary care as nurse practitioners. So my research question was, can primary care nurse practitioners prescribe walking to adults to prevent and or improve cardiovascular risk and all-cause mortality? So my review of the literature went well, and there was 4 main key points that I highlighted in my presentation, and I will highlight here as well. Number 1 is that just generally, more steps per day equals greater reduction in mortality risk. However, that risk reduction does plateau, and it's based on the age range. So in those greater than age of 60, the risk reduction plateaus at 6,000 to 8,000 steps a day. Whereas in adults that are less than 60, the risk reduction plateaus at 8,000 to 10,000 steps per day. Number 2 key point was that in adults over the age of 60, getting 6,000 to 9,000 steps per day was associated with a 40 to 50% lower risk of cardiovascular disease. So that's a really huge number. Number 3 of the key points is that an increase of 500 steps per day is associated with a 7% decrease in cardiovascular mortality, and an increase in 1,000 steps per day is associated with a 15% decrease in all-cause mortality. And number 4, and which is important because it can help us with people who have issues with consistency or time, getting greater than or equal to 8,000 steps, even on 1 to 2 days per week, is still associated with decreased all-cause and cardiovascular mortality. Okay, so for my presentation, I wanted to present to one of the other nurse practitioner classes. So I presented in Dr. Yurovich's in the second year class. So by analyzing my learners, I knew that they were going to be BSN prepared nurses who are currently undergoing nurse practitioner training for primary care. My objectives are in the top right corner here, which I stated prior to the presentation, and that was to identify the risks of inactivity and the benefits of activity, to review the U.S. Physical Activity Guidelines, second edition, to distinguish between moderate and vigorous activity, to highlight the key points from the research, which is the effect of walking and step count on mortality, which we just reviewed in the review of literature, and having the audience feel comfortable discussing step goals and walking with patients in primary care. My method was going to be by presentation in person in their class. Media and materials that were used, I did use a PowerPoint presentation for the presentation, and I provided a handout to the students which summarized some of the key information presented, as well as the key points from the research, and then some suggestions about how they can apply that in practice, just kind of to be a resource for if they wanted to call back on that at a future time when they're seeing patients. The presentation overall went very well. The required learner participation, we had a very great discussion afterwards that just touched on a lot of different lifestyle modifications and how we deal with that in practice, and just exercise in general. It was a very nice discussion, good group. And then I was to, as with the Assure method, finalize this with evaluation and revision. So my evaluation, first, there was a post-test following the presentation that was a series of questions to the learners. And two of the questions I've included here was, how often do you speak to patients about exercise? We had 4 people say frequently, we had 6 people say occasionally, and 1 person said rarely. However, asked how likely are you to discuss walking and step count with patients, 9 people said very likely, and 2 people said somewhat likely. So like I said, overall, the presentation went very well. I'm very happy with it. I think my only complaint, if anything, about the presentation was I would have gladly presented to a lot more people. And I probably could have arranged that better or done a few presentations, not just the one. I just think it's a really important topic. I think it's very, not only great for patients, but it's great for us to kind of have in our arsenal, because exercise is something we will talk to patients about so much. My other evaluation of myself was that when I had very poor alignment of my objectives and my evaluation. Not a great excuse, but was not feeling great at the time and had a very poor understanding ultimately of how the post-test was going to work. I should have really spent some more time determining my objectives with some consideration to what I wanted to measure. And I just didn't, it didn't all click and come together. So I was essentially asking questions that don't, in the end, provide me with much evidence of anything. So I do think that while that was my largest mistake of all, it was also my greatest learning experience. So I'm very happy for it. I know that, I never forget my mistakes. I certainly learn from them. And I think that that will be a great lesson going forward in any future projects that I work on. I thank you all so much for this opportunity. Have a great day.